Hello and welcome to Carolina Conceptions. My name is Ashley Rickett and I'm the Patient Access Supervisor here at Carolina Conceptions. Today I'm representing our Patient Access Coordinators who are here to help during the new patient process and all things scheduling. Whether you live in the Central Raleigh, North Raleigh, or Wilmington areas, we are here to help provide the best patient care possible. You can also reach us by patient portal or via the phone. For consultations, our office tries to be as flexible as possible. We offer in-person, virtual, and phone appointments. We understand that your lives are busy and we try to accommodate the best that we can. You can expect to see our coordinators here at check-in and during the checkout processes. If you also need help facilitating your medical records, we are happy to help obtain and release those as well. Thank you so much for taking the time to be here with us today. We wish you all the best, and we're so glad that you're here.
Hi, my name is Monique, and I am one of 2 financial counselors here at Carolina Conceptions. You will typically see me at all stages of your cycle treatments. We typically handle all insurance-related questions, payments, and an array of other items. So feel free to stop by and ask any questions regarding those things or send a message in the portal, or you can also call if you have any questions regarding your cycle, insurance, or any payments. I look forward to working with you soon.
Hi, I'm Jada,
And I'm Elizabeth.
and we are CMAs here at Carolina Conceptions.
You may see us in this lab drawing your blood, rooming you in one of our exam rooms, taking your vitals, taking you to a doctor's office, or you may see us in some of our procedures like retrievals, transfers, HSGs, or salines.
I am in charge of doing your medication prior authorizations for your cycle.
And I am in charge of helping you find any emotional resources that you may need to get through your journey. We look forward to seeing you here at Carolina Conceptions and can't wait to see your smiling face.
Hello, my name is Kenyatta. I am one of the nurses here at Carolina Conceptions, and I will be representing the nursing IVF team here. Your IVF nursing team, we play multiple roles through your journey here. We're the ones who will be doing your ultrasounds and sending out your medications for your IVF cycle. We will also be the ones answering your questions through the portal, so any medical questions that you may have, we will write back to you and give you those answers. There's 5 nurses in total, and you're not just gonna see one nurse. It'll be all of us throughout your journey. We all know what you will be doing for your IVF plan. So if you see one of us, just ask us a question if you have any questions, and we'll be happy to help you.
Hi, I'm Lexi Diefendorfer. I'm a physician associate or a PA here at Carolina Conceptions. I'm one of the 4 APPs around Carolina Conceptions in the various offices. You might see me in one of these exam rooms. Here I see virtual patients to treat infertility causes and reoccurring pregnancy losses. I treat and diagnose patients. I also do a lot of the procedures here, so that includes saline, ultrasounds, HSGs, and IUIs, and I also help first assist in the operating room when the doctors need me. In addition to these things, I also help the nurses with IVF nurses classes, and I help with monitoring scans and on the triage line. So you might see me in any of these various settings, and I look forward to meeting you.
Hey everyone, my name is Megan. I am one of the embryologists and one of the lab supervisors here at Carolina Conceptions. You'll probably see our department the least when you're here. That's because you'll only interact with us when you have embryos in culture here in the lab, after your retrieval or before your transfer, or if you come in for a frozen transfer. So you can always reach out to us if you do have questions about your embryos. We're happy to answer any of them or just walk you through the process. But we look forward to seeing you.
Hi, I'm Dr. Bowling. I work here at Carolina Conceptions and I've worked here since 2017. Our practice is a practice of 5 amazing doctors, as well as nurse practitioners and physician assistants. We work here at Carolina Conceptions as a team, and so you will start your process here with us by meeting with your primary doctor, and once you meet with them, then you'll start to get to know all of us. So we all here perform ultrasounds and help make decisions on your care plan. So you'll meet with your primary doctor first and come up with a care plan. From there, you'll be doing lab testing, ultrasounds, HSGs to evaluate fallopian tubes, and saline sonograms to evaluate your uterine lining. And all these tests might be performed by one of the physicians, not necessarily yours, or one of our physician assistants or nurse practitioners. This is to help you move through the process as fast as possible, because it is possible that your doctor might not be available on the day you need these tests done, which is oftentimes your period. So we try to keep you moving through the workup pretty quickly. We also have nurses who do ultrasounds in the morning for us for your follicle monitoring. And this is great because you can get in quickly to see the nurse. And then the beauty of our system is that your doctor, your primary doctor, is always reviewing every single ultrasound image that you had done that day and your lab levels, and making the final decision later that day when they have a time to review them, usually later in the afternoon. And then we contact you later that day and give you the official plan once your doctor has reviewed everything. So we just like to let patients know that, because sometimes you can feel like, I'm not seeing my doctor at every visit, but this is okay because your doctor is seeing all of your information every visit, even if you don't see each other face to face. And we're always available on the portal to answer any questions that you might have. One other thing we want you to know is that when you are scheduled for big procedures like the egg retrieval and the embryo transfer, because of the way our schedule works, it may not be your doctor doing that procedure. The reason for this is that, again, so much of our IVF treatment is based on when your period starts, and our doctors are kind of rotating through different pieces of patient care each week. So some weeks I might be doing consults, seeing new patients and follow-up patients, and then other weeks I might be the IVF doctor, which means I'm the doctor responsible for doing the egg retrievals and the embryo transfers for patients who are going through that week. And so part of the reason we like you to meet everybody at our clinic is because I personally think we're all awesome, and we want you to get to know all of our awesome team members, and to help you feel more comfortable so that on the day of your egg retrieval, you've met the doctor who might be doing your procedure that day. So our process of having you meet different members of our team is helpful and will prepare you when you go to your OB doctor. The way pretty much all OB practices work now is that there is a group of doctors, and you will have your primary doctor there, but you'll meet all the doctors throughout your pregnancy, because we never know who's going to be the doctor working in the hospital the day that you're ready to deliver your baby. So it's helpful to have a team and know that we're all taking care of you. I think the other great thing about our practice here at Carolina Conceptions is that we all practice in a very, very similar manner. And so when we are making decisions for patients, it's similar between doctors, so you can expect to get the same great care from all the doctors here. I love our patient portal. I think it has been a huge help to our practice since we got our new medical record system. I tell patients that we literally have nurses manning our portal so that we can get back to you within just a few hours. So I always encourage my patients to use the patient portal. You're always welcome to call us by phone, but we can help you probably faster with the patient portal. We can help answer clinical questions, schedule appointments, or address any questions or concerns you have about your treatment plan. So we just really encourage everyone to use the portal. It's been awesome. It really is the fastest way to get an answer for your question. And even if you don't speak with your doctor directly on the portal, know that our nurses are coming to us with all your questions. They're just trying to get back to you in the fastest way possible, because you know doctors are going to be a little bit slower with their busy day. We want you to have your answer as quickly as possible. As far as scheduling appointments, I always tell my patients, schedule things out ahead of time. We go through waves during the year where we have really busy times, a lot of time at the very beginning of the year and the very end of the year, where sometimes things like appointments with your doctor or appointments for IVF classes can book out by a couple of weeks. And so we don't want patients to get frustrated in those situations. So if you have a sense that you want to do a certain treatment a few months from now, it's no problem for you to kind of reach out to us and say, hey, what do I need to schedule? And we'll help you get scheduled in advance so we keep your timeline where you want it to be, rather than getting frustrated if you have to wait a couple of weeks when you weren't anticipating that. I also tell my patients that usually once we see each other the first time, you're going to probably get into some treatment cycles. And we usually recommend going through about 2 or 3 of the same treatment in a row. That usually takes about 2 or 3 months. If at that point you're not pregnant, we always want to have a follow-up appointment to review what we've learned about your cycles. And so I always encourage my patients to anticipate if there's any question about your treatment plan, or you want to hear about different options for us to talk about next steps. It's always good to kind of plan out a follow-up appointment. And so I think that's always a helpful tip I have for my patients as well. What I love about Carolina Conceptions is that we have amazing pregnancy rates. And the reason we have amazing pregnancy rates is because we have an amazing team, and we have a well-oiled machine to help you move through this process as fast as you can, while keeping the personal aspect of it with you. Our doctors are amazing. Our nurses are amazing. Our administrative staff, who helps you with all of the pieces of finance and scheduling and insurance and working with the front desk, we are all just really here for you. And our common goal is to make sure that we give you the best care we can, keep things moving for you while supporting you through this process. I think what I love about this practice is that everyone here is kind and is rooting for you, and we are here to help you. And so we've designed our system like that, and we really want to do our best for you. So with that being said, we're passionate about what we do, and we really look forward to meeting you and helping you on your fertility journey.